Hello, this is Dr. Alan Menter. I am chairman of the Department of Dermatology at Baylor University Medical Center in Dallas. I will be discussing adverse medical conditions in patients with psoriasis treated with biologic versus conventional systemic therapy, a United States claims-based analysis. The poster was presented by Dr. Wu and colleagues at the 76th annual meeting of the American Academy of Dermatology in February 16 to 20th, 2018, which was held in San Diego, California. In summary, this was a retrospective analysis of data from the Truman Health Analytics Market Scan Commercial Claims and Encounters database. The purpose was to compare the risk of developing adverse medical conditions among biologic-naive patients versus patients treated subsequently with a biologic in a real-world setting. The analysis showed that biologic therapies were associated with a similar or lower risk of adverse medical conditions compared to conventional systemic therapies or topical therapies amongst biologic-naive adult patients with psoriasis. What about the importance of the study? Biologic therapies are associated with superior symptom management in patients with moderate to severe psoriasis compared to other conventional systemic therapies. Previous real-world studies have assessed the risk of biologics, but in a limited number of adverse medical conditions and in heterogeneous populations. This real-world analysis assessed the risk of developing adverse medical conditions described in product labeling in biologic-naive patients with psoriasis. Now, the description of the study. Patients were adults with psoriasis diagnosed on 2 or more dates, one of which was by a dermatologist. All of these patients were biologic naive at the index date. The index date was the date on which the first biologic therapy or conventional systemic therapy or topical therapy was initiated. 2 mutually exclusive cohorts were created based on receiving either biologic or conventional systemic therapy or topical therapy. The biologic cohort was stratified into 4 cohorts: adalimumab, etanercept, ustekinumab, or other biologics. In other words, a combination of etanercept, ustekinumab, and infliximab. Patients were followed until the first occurrence of one of the following: initiation of a systemic therapy for psoriasis other than the index treatment, 60 days after the index treatment discontinuation, and thirdly, the end of data availability of continuous health plan enrollment. Studied adverse medical conditions were selected on FDA product labeling and post-marketing surveillance registries. Only incident events based on ICD-9 CM diagnosis code were analyzed. Multivariate Cox proportional hazard regression models were used to compare the risk of developing an adverse medical condition between the different cohorts. So what was the key findings in the study? 42,981 biologic-naive patients met the inclusion criteria, which included enrollment in their healthcare plan for over 12 months prior to and over 1 month after the index date. 5,197 patients were treated with adalimumab, 3,311 with etanercept, 1,370 with ustekinumab, and 187 patients with infliximab. 19,666 patients were treated with topical therapy and 13,250 with conventional systemic therapy, which included phototherapy, methotrexate, acitretin, or isotretinoin. The median age in the cohorts was adalimumab 46 years, etanercept 46 years, ustekinumab 47 years, and conventional systemic therapy or topical therapy 50 years. The proportion of females was slightly less than 50% in the biologic cohorts and significantly lower than in the conventional systemic therapy topical cohort, 53.1%. The median study period duration was significantly longer for biologic cohorts than conventional systemic therapy or topical therapy, ranging from 5.3 to 7.9 months versus 3.3 months respectively. What about the adverse medical conditions? Infections occurred in 28.7%, to 41.8%. Mental disorder in 9.3% versus 18.3%. Abnormal laboratory tests in 6.0% to 10.8%. Cardiovascular disease in 3.3% to 5.5%. Malignancy 2.1% to 2.6%. And respiratory disease in 1.9% to 3.7%. The risk of an adverse medical condition was similar or lower in patients treated with a biologic versus conventional systemic therapy. Those that were significantly lower with biologic therapy compared to conventional systemic or topical therapy included: 1, the risk of infection with adalimumab, etanercept, and ustekinumab, hazard ratio 0.86 to 0.93. The risk of malignancy with adalimumab, the hazard ratio was 0.71. And the risk of respiratory disease with etanercept, in which the hazard ratio was 0.80. The risk of adverse medical conditions was similar between adalimumab and the combination of etanercept, ustekinumab, and infliximab. What about limitations of the study? This included a limited follow-up period. Statistical power may have been limited due to the low incidence of some adverse medical conditions that were observed, and disease severity may be a potential confounding factor, since biologic therapies may be prescribed for patients with more severe psoriasis compared to conventional systemic therapy or topical therapies. Only adverse medical conditions for which patients sought medical care were analyzed. Here are my thoughts and analysis of this study. Number 1, biologic agents are commonly now used in the field of psoriasis. But on the other hand, they're not as commonly used as we used to use systemic therapy. In fact, in the United States currently, less than 1 out of 5 patients who are eligible for systemic or biologic therapy are receiving biologic or systemic therapy. So that's an important aspect that I think we all need to recognize. How do the results of the study impact the current state of medical management? I do believe that we can assure both our dermatology colleagues and patients that we have long-term safety data on biologic agents in comparison to traditional systemic drugs. Admittedly, we've had methotrexate for over 40 years. We've only had biologic drugs for over 20 years. But the numbers and the long-term side effect database, I do believe, allows us to assure both our colleagues in dermatology and patients about the long-term safety. And I use the term personally, long-term safe control. I really do believe that's important for our patients. What about the results of the study? How does it impact the future state of patient management? Hopefully, as I said earlier, we can slowly increase the number of patients who have moderate to severe psoriasis who can achieve appropriate and receive appropriate systemic or biologic agents. As I said, we have approximately 7.5 million psoriasis patients in the US currently. 20% of them have moderate to severe psoriasis. That's 1.5 million. Currently, less than 25% of that 1.5 million patients with moderate to severe psoriasis are being treated with appropriate biologics and systemic therapy. And I do believe that this analysis of this study allows us to feel much more comfortable utilizing these drugs.